And their picture you were gonna do.
So allowed to talk.
Yeah.
Hey, guys,
Hi,
for this
Megan.
session only today, we are going to allow the attendees in and you guys are gonna be able to permitted to talk to us.
Woohoo!
You're welcome to turn your cameras on, but you don't have to. It's up to you. We see your names.
Good morning, Linda. Good morning, Mary. Good morning, Heather. You're not a newbie.
She feels like one.
And neither is Megan.
Glad to have you though.
She just wants to see us all awake bright and early.
That's wonderful. I'm glad you guys are here.
I got coffee in hand.
Hi,
Same. Cheers.
I can't hear you.
I heard ya.
I heard somebody.
Heather, Linda, and Mary, you're muted. Might be on your end.
Yeah, if you guys want to talk, you have the ability, but you have to unmute yourselves. There you go. Welcome, welcome.
Hi, Shannon.
Hi, can you hear me?
I can.
Hello,
Hello.
Hi, Miss Megan.
how are you? My mom's here too.
Nancy's here.
Hey.
Hi,
Did a
Nancy.
great job yesterday.
I'm so glad you guys are here.
We're very happy to be here.
Is anyone on the West Coast? Besides Deb?
I think she's up west.
Well,
She got up, so it was good.
it's, right now, it's what, 4 o'clock in the morning? So yeah.
Morning, Mary.
Early.
Morning.
Okay, to those who have just popped on, we are making it available for you to be able to speak. So all you need to do is unmute yourself. You can put your picture up if you would like.
Or your face.
Maybe somebody new does it.
Yeah. Zoom user, yeah.
Oh, that's a pain. I was wondering how it worked.
That's all right. Good morning, Zoom user.
Morning.
Oh, it's a guy. Who is it?
Whoa.
Yeah, hi, my name's Roger Evans.
Hi, Roger.
Welcome, Roger.
I live in Colorado.
Oh, so it's early for you.
There's something in the chat about.
Something in the chat?
Oh,
Oh,
Morning.
morning.
Hey, Bob, it's Roger Evans. Remember me?
Yep, I talked to you on the phone a couple months ago, right?
No, I used to be a board member a long time ago.
Oh, that's right, that's right. So that would have been what,
Back in
What years was that
2000,
again?
I was a board member from 2007 to 2012.
okay.
okay.
Yeah, I had, Jim and Carol and Julie and Loretta
Lorraine.
and me and you,
Yeah.
I think.
Yeah, Lorraine just had her birthday yesterday.
Did she
Oh, did
really?
she?
She did.
That sounds
Mhm.
familiar.
Well,
Hi,
I'll
guys.
be 62 in January, so
62 years young.
yeah.
Just to let anyone new on the line know that you have the availability to unmute yourself. And if you would like to show your picture, that's fine. If not, that's fine also. But we're
Can you
gonna
guys
make it
see
real
me?
casual this morning.
Can you guys see me okay?
I do not see you.
Zoom user, I don't see Zoom user. No, I don't see your picture yet.
Oh,
And I am gonna
How do I
change the
get-
name.
how do I get a picture on there?
You,
You just turn on your camera.
Oh, it didn't ask me for a camera thing. Hold on.
Bottom left of your computer.
I'm on my
Yeah.
phone. On my iPhone.
Oh.
We're on phone.
I've never had, even on your phone, you should be able to,
Well, it's okay. Not everybody has their pictures up though.
yeah.
no, but
I don't know how to do it.
Yeah, I can see you guys
Hi,
fine. I can see you guys
Susan.
fine now.
We'll give it another minute or two and then we'll go.
Now, Rogers, your last name is an A, is Evans with an E or an A?
Evans.
Okay.
Oh, look at you.
I'm gonna stay on mute. My dogs are wrestling.
Okay.
There you go. I totally understand.
Yes, please
Hi,
excuse
Ellen.
mine if she starts barking.
Hi, Sandra. Hi, Tisa.
Hello.
It's 7:02. Okay, does everyone have their cup of coffee? Or their cup of tea?
Yeah.
I have
I
a
got my, I got my soda.
I have
Oh,
to
there you
leave.
go. You and someone else I know, Miss Patty, she's the soda girl in the morning. Well, I'd like to welcome everyone, and if you didn't hear before, you have the ability to unmute yourself while we're talking and speak. We're going to try and do this decently in an order, so we don't run on top of each other, but we just wanted you to have the opportunity to talk and get to see what you would like to learn out of this. The biggest key for me right now is to make sure that you all have a pad of paper and a pen. Because you're going to want to take notes if you haven't already. The other thing you want to do is if you have a highlighter, I like highlighters, but if you don't, put a box around words you don't understand and write them down so that you can either go back later to Google or whatever. Like yesterday, I took notes and I kind of understood what certain words were, but I didn't understand how they went together. For ascendus, they had transient conjugating, and I was like, oh, okay, how do those two go together? So I looked them up, and transient means lasting only a short time. So that makes sense, because when I think of transient, I just think of, I don't know, people moving in and out.
Yes, so it moves around a lot.
And conjugating, well, that has another term, but it's the union of cells together. So then that helps me understand and it makes more sense. How many of you were on, oh, let's show of hands, because you got a little hand, raise hand. How many of you were on yesterday? Good job. Okay. I like this. Can someone share one thing that they've learned yesterday?
I learned about laryngospasms and bronchospasms. I have a paralyzed voice box. And so I have those a lot, and I wasn't sure if it was calcium related or not. So I learned that it could be calcium related also.
Very good. Yes, it could be. Anybody else?
I was happy to learn that there are so many different treatment options in the works. We all hear about Transcom, but it was very interesting to hear from Analyte and Calcilytics about what they're doing. And it's very promising as someone who's had hypopara for half my life to know that there are going to be options.
Absolutely. Mary, did you want to say something?
Yeah, I was interested to see that doctors often
You don't,
have
Phyllis.
no idea what some of the symptoms are. And they miss so many things that are such a part of daily life.
Yes.
Yeah, and it's good because as a recent shift in the medical field, when it comes to approving these therapies,
In your bed.
these companies have to have the patient experience is part of that decision-making process, and the FDA is actually requiring that. So it's not just, hey, can we just treat the underlying cause, but it has to be productive and increase quality of life. And there's all these other measures. So that's new within probably the last 15 years or so. Roger, you might have been a part of the board when that all took place, but I think I'm pretty
Yeah,
sure.
Nat Para, yeah. Mhm.
Yeah, getting that approved and getting the agency in to hear that and then seeing that shift go around the world has been neat to see.
Heather, did you have something to say? You're muted, Heather.
No.
Okay. Megan, did you have something? If I see your hand up, I'm gonna call on you. So Megan, did you have something to say?
Oh, no.
Okay. I'm gonna pretend, yeah, school's in session. Kathy?
Heather's mic doesn't work, so she was typing, and
Oh, got
she
it.
did say that it's she was happy to see that getting labs are important to do. As I forget which doctors, Dr. Khan, if once a week isn't enough, then go once a day. And I think that Heather was happy to hear that. Let me know if that's correct, Heather.
Yeah, these new guidelines that the task force that Dr. Khan was leading are going to be a game changer, I think. It's not quite, they don't have the information or the studies to say that hormone replacement is going to be the standard of care in the, right now. It might change in the future, but just having those guidelines that will be accepted around the world that these doctors could look up and, you'd be able to, once they're out, we'll be able to print them off and take you with you. So if you end up in the emergency room or the doctor's office, you could take those with you and say, look, it's a guideline on how to treat this and how to help me. So I think it's going to be a great educational tool for a lot of people.
Yep. Kathy?
I've been hypopara for about 12 years, and there are a lot of things that kind of fall into place, but then there are things that you forget that you knew earlier. And one thing I had forgotten was the importance of taking your calcium with your meal because of calcium binding with phosphorus.
Mhm.
Absolutely.
I find I have to watch my phosphorus level. I can usually keep it within the normal range, but I have to kind of keep an eye on it. Yesterday, it was interesting to me to hear about the different drugs in development, and yet I think of more the commercial aspect of it. One of them used that term. I think the Takeda person. These drugs sound awfully expensive for a small patient population. And I don't really have a good handle on how on earth as a patient, when I do have all these options, I'm actually going to make a choice. So when Dr. Shu was talking about the structure of the TransCon, it sounded interesting, but I really wanted to say, okay, and what that means to me is, like, what is the significance of you're using this particular protein or this particular part of the molecule? Because I think it felt a little bit like you're listening to brand names. Okay, we're talking about cars. Is this one a Toyota? Is this one a Ford? Is this one a Mercedes? And can we all afford a Mercedes? Can we not? Or are we not even talking that broadly? Are they much closer than that? Are we talking about GM products? So one's a Chev, one's a Cadillac, one's a Buick. So how important are those differences? Are they significant? Are they minor? And what are the differences in terms of outcomes or patient experience when you're on one of those drugs? I found it left me with a lot of questions, but stirred up a lot of thoughts that I felt it moved me forward in my process of understanding these options. So I thought that was excellent.
Well, one thing, if you noticed, when that pair first came out, it's an injection. Same thing with Forteo, right? It was just a one injection a day, and then you get off label, and they were doing split dosing it maybe 2 or 3 times a day. And if you've noticed, Amylite, well, not Takeda because they're still dealing with their issues, but TransCon, it's all stuff that's designed to last in your system over a longer period of time. so you don't have those split doses, right? And I think they finally understand the importance. It's not just give a shot and you're done. No, you know, we need these, the hormones, you need the PTH in your blood the entire time. And like if you look at TransCon and Amy Shu's presentation, that TransCon, that protein linker, they use that for all their drugs. It's just a carrying device, and it's the PTH that's specific to hypopara, the 1 through 34. But their TransCon technology is across the board. That's what they focus on. And I think you might have something there, you know, which one is going to be best. And it was clear being part of that task force that those, you know, even though like Natpara's been on the market and even Forteo's been on the market off-label for a long time, there has not been any long-term studies of the effects of these drugs on people. And that's the data. If you listen to Dr. Khan yesterday, they just don't have that data, right? So we have a lot of studies, but there's no long-term studies. So those are some of the things that we are actually working with the doctors on and trying to set up some registries and some different studies to help get that information so we can make those decisions.
Sorry, I just wanted to say, I wasn't sure from the TransCon and the other presentation, but the letters, what was it? P-3601, whatever that other drug was. Do they use the same delivery mechanism? Are they likely to go through the same issues that Takeda has with Natpara?
So calcilytics is an oral pill.
Okay.
The AZ is going to be an injectable, but
We could come in here, Michelle. You can say hi. She's our medical expert.
Well, I'm not a medical expert, but just so I'm just going to give a comparison because I was on Natpara and then I'm now on TransCon. And so delivery mechanism wise, yes, they're both injectables. Yes, they both come from an automatic pen, but no, is it the exact same delivery in the pen? No, they use a different mechanism by which the pen works. So do I think it's going to cause the same problem? No. I hope that answers your question. And then, do you want me to go ahead and read that?
Yeah, you can go ahead and answer that.
Okay,
since
so
you're a
I
pharmacist.
slipped Bob a little a note that said about your pricing question, whoever that was that asked.
Kathy.
Pricing on these drugs, yes, these drugs are going to be very expensive when they first come out because they usually have orphan drug status. Although if there's multiple of them coming out on the market at the same time, they won't all be orphan drug, but regardless, when they first come out, they're trying to make up the money they spent in research and development, and they're expensive. But the good news is that most of these drugs will have a patient assistance program to pay for them. And so like when I first went on Natpara, it cost $10,000 a month, but the Natpara or Shire at the time set up a patient assistance program, whereas they actually they have donors that help pay for the patients to get the drug. So to me, it costs $0.
But every program is different.
Yes, every program is different, but usually every pharma company has some sort of program.
Yeah.
Even Forteo has a patient assistance program where they will pay for a portion of the drug. So I wouldn't get too concerned about these drugs being the Cadillac of the market and you as a patient may not be able to afford it. There are going to be options. We don't know what those options are right now, but there will be some options. I hope that helps make things make a little more sense.
It sounded like at first it would be paid for the first year, but after that, it seems somewhat in question. So are third-party insurers picking up the cost of this medication, or are they leaving it to the patient assistance programs from the manufacturer?
that's something we're just going to have to look at later on because most of these drugs, you know, they're still a year or two out.
Yeah.
And so we can't say.
So how do you take charge of it as a patient though? So you become an advocate for yourself. You also get your doctor, like continue on working with your doctor to make sure they're an advocate for you to find all the avenues. So sometimes it's
sometimes you
self-research.
have to fight your insurance company and you have to have your doctor write letters 2-3 times. I know a lot of people that were on Natpara had to do that. They had to, you know, keep fighting and get what's called a prior authorization through their insurance company. My particular insurance company did pick up the cost after the first year. They were good and they paid for it. I was on it for 3 years total. So It's going to depend on your insurance company, and then you do need to find a good endo to help you through the process.
Ascendis just had FDA approval for their human growth hormone, which is in the same format as the transgene technology of the parathyroid hormone. So we might be able to get a good judge, because they're, at least 6 months in front of the PTH of how the cost structure might work and how assistance might work. So we might want to look to that, and see in 6 months what they're doing, and that might judge what will happen for us in the future.
Okay. All right, Linda, you had a question?
Well, it was
Or
on the
comment?
same
Oh.
guidelines.
Uh-huh.
With the cost, for example, my insurance company had NatPara on it, but they wanted $2,500 a month for my portion of NatPara, which on our budget, we just can't afford $2,500 a month. And my fear is once you get on these drugs and then they pull away the funding from you, then what do? You're already hooked on them and you can't afford them.
Well, Linda, that's just like what Patty was saying, is we just need to make sure that we're a big advocate for ourselves and an advocate, get our doctors to be an advocate. And then we also need to work with our legislature. That's one area I never thought we'd have to get into, but we do, because the legislature and the FDA are both integral parts of how we can keep our costs down. So when you see something come up from us that say we need help with something and that we're working on, please jump in, become an advocate with us.
And I'm
Okay.
like Michelle was saying, I'm hoping that as these therapies start coming to market, they're no longer want to be considered an orphan drug. And I think that's going to help push the price down into a more affordable.
You have 3 on the market.
Yeah, they're going to be
compete
competing.
against each other. They're going to have to keep the cost down so that you'll choose theirs over the other ones.
Yeah. So, I mean, there'll be some good hopefully there'll be some decent competition there.
Hey, Megan? Or you just still have your hand up?
Sissy just showed up
Oh.
too.
Sissy,
Hello.
did you have a question, Megan? Oh,
No.
you're good. Okay.
Yes,
Yes,
Roger
Roger.
Evans. I have a question.
Hi.
Like Bob was saying, I was on the initial NatPara clinical trial with Dr. Rubin back in 2007, 2008 time period, right around there. And what they learned about my situation with my hypoparathyroidism, because I was born with it, I've had it all my life. I'm 61 years old now. They were finding that I needed to have more than 1 injection per day to keep my calcium levels normal. So they said that I would need at least like 3 shots a day. And they said that's going beyond the scope of the clinical trial. Therefore, I wasn't really able to continue treating with NatPara at that time. And it never really did work. The 1 injection never really did work for me. And as far as me participating in like TransCon PTH's clinical trial, it seems like I'm exempt from all these trials because of other health conditions like pancreatic cancer. I have pancreatic cancer now, and I have stage 4 chronic kidney disease. I'm getting ready to go on dialysis. So
I'm sorry to hear that.
I've got all kinds of moving parts here in my health care.
Yeah.
And my doctors just can't seem to grasp what I'm having to go through. And I have to go to the hospital, guys, 3 times a week to get calcium by infusion. That's the only thing that works for me. And I've been in controlled environments where my doctor is standing right there, my endocrinologist. She's doing my lab work and saying, oh, your calcium is low. We're going to give you calcium by IV. Okay, go ahead and give me the calcium by IV. We're going to give you vitamin D by infusion. Okay, go ahead and do that. And then like 12 hours later, they'll come back and check my calcium again, and it's already down. It goes up and went right back down. So like what Bob was saying, it needs to be able to stay in our bodies for a longer period of time than just a couple of hours in
Correct.
order to really help people like us. Because
Roger,
I don't
have
have,
you ever? Okay, sorry.
I don't have parathyroid glands. I was born
So-
without them.
Have you, I know there's been a lot of interest in pump therapy, especially, and I know a lot of people have had success with pump therapy with Forteo. And there is some people that are on this, the NAPERA on this, even now with the special use program that are using pumps. And again, it's to mimic that, keeping the PTH hormone in your body the entire time. So
Right.
have you tried to look at, I don't know if you're able to, but Forteo and possibly a pump therapy? I mean, it's obviously going to take some work to get with your insurance because it's all off label, and then the pump adds another layer to that. But we do
Yeah,
have some people with experiences.
I'm on Medicare and Medicaid. I'm on Medicare and Medicaid now, so I don't know if they would cover that or not. So, but I would, every time I try to get like a parathyroid gland transplant, which I tried to get when I was on the board back in 2007, I had private insurance then. They said no. Now I'm at stage 4 kidney. I needed to get a kidney transplant. They said no, you're not a candidate for kidney transplant. Everybody for pancreatic cancer, they want to take out the tumor, but they say no, you're not a candidate for that either. So it's like I'm always told no, 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 no. So, and now I'm 61 years old, and I'm really frightened if my pancreatic cancer starts to spread, and then my kidneys shut down, and then I've got this hypoparathyroidism with needing calcium 3 times a week. Am I going to be living at the hospital now, or what?
Roger,
So
would it be
yeah,
available for you to write down your story and send it to us?
yeah, I can certainly do that. Yeah,
Because
I mean,
those are the kind of stories that we need
That would be
to have so
Great
that
for
we
the
can
agency.
share with the FDA and, just any of you. These are things that we can do to advocate for ourselves.
and all my
So I'd love to
doctors,
share.
they love them. I love them all dearly, but it's like they're kind of clueless
Yes.
sometimes.
Well, they're learning.
Yeah, they're living and learning, right? Like we all are.
Yes, absolutely.
And I haven't gotten COVID being around healthcare workers 3 times a week, because I'm at the hospital 3 hours to 4 hours each time, and there's other patients there that are getting treatment too. And I haven't gotten COVID, but I'm extreme high risk for COVID, and I'm vaccinated and everything, but I've never gotten it.
Good.
Thankfully.
Barry, did you have something to say?
Yeah, I just wanted to say, I'm sorry for what you're going through, but please do send your story. And I like to share stories not only with the FDA, but with the patient community. And this is directed to everyone on this site right now. Please do send your stories. I do this Warrior Wednesday series and I share all of your stories. Just send it to admin@hypopara.org. And people like to hear, they relate and it's just, I like to share this, and your story is a powerful one and we'd like to follow your journey.
Yeah, I appreciate
Absolutely.
that, because we need to get more awareness. We need to get more awareness out there, about this condition.
Sharing the stories make people feel less alone, and you probably
Okay.
feel alone going through this, and we don't
All
want
right.
people to
I
feel
come in there, I
alone.
didn't want to interrupt you.
Hi, Tisa, do you have something to share?
I just, a lot of my questions got answered just listening to the conversation, but I just had like some thoughts on the medications. Just one of the things that was being talked about was the comparisons of the medications, and just clearing up a couple of things about like Transcon versus Natpara. Some of the, I don't know where I'm getting this or where I've read it, but can you hear me?
Yeah.
Yes.
Okay.
Yes.
Like with the Transcon, I've kind of read that you don't have to keep that cold, but that the Natpara you have to keep in the refrigerator or whatever. So I mean that would be like a good thing to me. I was also wondering about I know with Natpara, like the people who have had to go off of it since it got pulled off the market, it almost sounds like they're worse off than they were before they started taking Natpara. And I was wondering if that would be the same reaction going off of TransCon, because, you know, like some of the people are saying, if they end up getting pulled off the drug because of insurance or money reasons, like that's kind of a big factor to me. So just kind of speaking to that. And then the other thing is about Forteo, because my doctor tried to get me Forteo. My insurance company rejected it for the reason that it's not true, you know, used for hypoparathyroidism. That was the reason that they denied it. And so she's in the process of doing like an appeal or whatever. But then it made me wonder, since they're saying it's not used for hypopara, is it really safe to use for hypopara?
So in regards to Forteo, and I'll let Michelle answer, Forteo is the 1 through 34 chain, right? And it's the exact same that TransCon is using. It's just TransCon is using that linker, that protein linker to slowly break it down. And so it definitely was, I believe, in the 90s, you know, my family was part of the Forteo trials at the NIH. And I was placebo, obviously, but that's fine. But yeah, I mean, it's obvious, it's safe for hypopara, but
Get your bone.
I think, you know, for whatever, what was it? I can't remember why it got, they shot it got designated for osteoporosis.
Yeah,
and not
it got
hypopara.
designated for another drug.
So,
So regarding some of your questions, so that yes, it is true, Natpara has to be refrigerated and remain refrigerated. TransCon, you have the option. So TransCon is best kept refrigerated if you're gonna have the pen for longer than 14 days. So the pen that you're not using, you always keep refrigerated. But when you're using, we need to, I'm sorry.
They're not talking, put them on mute. Large caps. Ethereum has been outperforming Bitcoin and large.
Okay, so we, for TransCon, it does have the option that you can keep the pen out of the refrigerator for up to 14 days, and each pen lasts 14 days. So you do have that option. So for traveling and stuff, it would be a little bit easier. I personally keep my TransCon pen in the fridge just because I feel like it's safer, but then I don't have to worry about, did I leave it out too long or whatever. So you do have those options. And then again, as Bob said, TransCon is the 1 to 34 chain. Natpara was the 1 to 84 chain, and Forteo is 1 to 34. I know that sounds like technical jargon, but basically PTH is a chain of 1 to 84 molecules. And Forteo and TransCon have taken just the first 34 because they believe that's all you need is the first 34 molecules of PTH to sustain your calcium levels. So I hope that explains a little bit about how that works.
Okay, so I have one more question about that. I was talking to the girl who covers like my FMLA time, and she was telling me, like, when I was telling her that Forteo, like that, my insurance company turned me down for Forteo, she said what she does, because she has diabetes, is that she will write to like the manufacturer and tell her case, so that like if they have extra medicine or something like that, she said she usually just gets her medicine by doing that. And she encouraged me to write to the manufacturer. So if the appeal doesn't go through, do you think something like that would work? Like, it just seems like forever.
It doesn't hurt, but also real quick, that reminded me that regarding that question that you had before, there is a letter that Dr. Manstadt, one of our medical directors, had written that tells physicians how to write an appeal for Forteo to get it approved. I believe it was posted on our website at one point. I'm not sure if it is, but if it isn't, we'll get it reposted onto our website so that you can look into that. But he is very big on using Forteo off label, and he has written a very excellent article that you can share with your physicians to help get that approved.
So like
you
if she already wrote the note then, and,
They can appeal it again and they can resend this letter that he wrote and then just fill
Okay.
in your personal information. So we'll make sure that that gets put on the website so that you can access it.
okay,
Perfect.
thank you.
These are the feelings that make you want to.
One more question.
There were two questions in the question and answer box. I don't know if you see that.
Yeah, Amelia, it has not been proven, but I really do believe that yes, neuropathy is part of what we go through. So, that would be my answer there. She said, thanks for all you're doing is small fiber neuropathy, a common result from recent hyperpara condition. Hyper or hypo neuropathy, it's not been proven, but personal experience, yes. And then I can't read the other one, it's too long. Okay, only got the stories growing rapidly. Like me need to be on that para. Oh. Okay, Min, hang on afterwards and I'll try and work with you, okay? Because I'm not quite sure I'm understanding what your question is. Okay, tomorrow morning, we won't be quite as early as we are this morning, right? Okay, but if you have any more questions or things you want to talk about, comments on what you've learned today, please write down your questions and we'll talk again tomorrow morning with our cup of coffee.
Enjoy the conference.
And enjoy the conference. Talk to you later.
Thanks everyone for joining.
Thank you.
All right, thank you. Bye.
Just the beginning of the morning.